Okay, so before you jump to treating the AC joint, treating the SC joint, treating the clavicle itself, treating the glenohumeral joint, we need to talk about soft tissue considerations for the whole kind of shoulder girdle area, especially anterior and lateral soft tissues, because really we want, from a soft tissue standpoint, the ability for the shoulder girdle and glenohumeral joint to be in the most optimal starting position to then do joint mobilizations. Okay, so things we need to think about anteriorly starting. So we have pec major, right? We have pec minor. Two main considerations. Pec major attachment onto sternum as well as the clavicle, and then it comes over, crosses over to the lateral bicipital groove area. So really it's thinking about any amount of working along the sternum, working the bony contour along the inferior portion of the clavicle. Then as we come a little bit lateral, we have coracoid process. So I need to do a bony contour of the coracoid process. We need to do some perpendicular deformation along pec minor, which is deep to pec major, attaches onto ribs 3, 4, and 5. So it kind of fans down here. Then moving even further lateral, we have the biceps tendon. So we need to do any amount of either strumming or perpendicular deformation along the biceps tendon. We have anterior deltoid here. We have lateral deltoid. Okay, so two things that when overactivated could be something that contributes to pulling the humeral head forward. We also, in this area, have the bony contour of the acromion process, so we could work on that. And then we have the joint line of the shoulder itself. Okay, so the glenohumeral joint line here that we may want to do a bony contour of. Now, as I bring her arm up, further considerations that we have is this whole lateral scapular border. Okay, so along the lateral scapular border, we do have tricep tendon comes in, lat comes in. That's the two most obvious things. Very deep on the anterior surface of the scapula, we have subscap. Okay, then as we move down, we have infraspinatus, we have teres minor, we have teres major. Okay, all along that area. And you know, if you know what rotational motion those muscles do, you can kind of resist the shoulder in that way to figure out what you're on. Okay, but just having in your head, working all along the lateral scapular border is going to be super important. And then we have everything above the clavicle, okay, and above the scapula. So we have anterior scalenes, middle scalenes, posterior scalenes. We have upper trapezius, and then we have levator that attaches on the supermedial border posteriorly. Okay, so thinking about all of these soft tissues, I think one soft tissue that I also left out is serratus anterior that kind of fans forward here, that you would have to work along some of the ribs laterally to get on that. But thinking about all of these soft tissues, getting them to be as springy and feel efficient as you can to then go in, work on AC joint, SC joint, clavicle, glenohumeral accessory motions, I think is very, very important, because if you jump straight to doing all the joint work, there may have been some soft tissue work that makes some of the joint work completely go away. Okay, so just wanted to get a video of all of the, or at least most of the soft tissues for you to consider working on before doing the joint stuff.